नमस्कार and hello friends. मैं डॉक्टर अरिंदम कौर, एडिशनल डायरेक्टर for Department of Critical Care Medicine from Sir H.N. Reliance Foundation Hospital. And I am speaking today on the subject of sepsis. Why so? Because 13th September this week, which was on Wednesday, we have had the World Sepsis Day. But we thought that Saturday people may have more time. लोगों के पास थोड़ा स्पेयर टाइम रहेंगे सुनने के लिए. So we thought that this is 12:30 would be on Saturday could be a good time for people to catch up on an update about sepsis. So sepsis has been a little difficult proposition to understand actually. So if I ask most of the people, including doctors, that what is sepsis, so it could be, I would say, most of the people may not have a good answers, including the doctors also, because uh, unlike other disease process like heart attack or stroke and others, sepsis doesn't have a very clear definition or a diagnostic definition. In fact, we have had multiple for last 30 years. हम लोगों ने डॉक्टर लोगों ने बहुत कोशिश की है, मल्टीपल कॉन्फ्रेंसेस भी हुए टू डिफाइन टू कम अप विद अ प्रॉपर डेफिनेशन ऑफ सेप्सिस, बट इट हैज बीन डिफिकल्ट. बट हम लोगों को जानना है ये है क्या, व्हाट इज सेप्सिस, राइट? सो सेप्सिस इज our body have an immunity to protect ourselves from different diseases and infection itself. And when an infection happens, right, in a way, so what we do, our body tries to protect through the immunity, as well as we take medicines, particularly antibiotics and others. अगर हमारा इम्यूनिटी और एंटीबायोटिक्स अच्छे से काम कर जाए तो आपका the infection would be cured. But what happens at times that infection can create a response in the immune system which is exaggerated or which is hyper responsive, right? मानो एनालॉजी कैसा है, जो घर में अगर आपका चोर आया, आप क्या करते हो? जो और चोर घुसने की कोशिश किए, आपने अलार्म बजा दिया, जोर से चिल्लाया, और पुलिस को फोन किए तो चोर भाग गए. सो दिस इज एन अप्रोप्रिएट रेस्पॉन्स, राइट? बट व्हाट इज एन हाइपर रेस्पॉन्स? चोर आया, आप चिल्ला तो किए ही, अलार्म तो बजाए, ऊपर से घर में आग भी लगा दिए. तो चोर तो चोरी कर नहीं पाया, लेकिन यू लूज योर एंटायर प्रॉपर्टी इटसेल्फ. So sepsis is an hyper acute or an exaggerated response of the immune system to an infection, which leads to multiple organ dysfunction or even failure. That means the immune system इतना जोर से वो react किया, which was supposed to protect ourselves, actually is damaging the body itself, and it can present as multiple organ dysfunction or even failure. And this doesn't follow a strict rule. That means some people may have one organ dysfunction, some people may have multiple organ dysfunctions, and the magnitude of dysfunction can be from a mild injury to complete failure, and there could be different permutation and combinations of the organ dysfunction. That's why it doesn't follow a certain rule. एंड इसीलिए ये समझना भी मुश्किल है इनिशियली कि लोगों को सेप्सिस हुआ है कि नहीं. And what is the fallout? If you are late, if you do not recognize sepsis, if you do not come to an experienced doctor who can pick up that the patient has not only infection, but that infection has led to a sepsis or a septic shock that is more advanced and grave situation, and if we do not act properly, you can lose your life, or the person can lose your life. Because despite all our advances, sepsis has one of the highest mortality. That means इसमें लोगों का जान जाने का चांसेस बहुत ज़्यादा है compared to even stroke or heart attack or even cancer. आज के दुनिया में अगर आप देखते हो, sepsis is the number one cause of mortality in hospitalized patients and number three cause of death amongst all sort of patients, and it has even surpassed cardiovascular deaths and the cancer death put together. So that's why any infection, so be it your tropical disease like dengue, malaria, leptospira and all others, or bacterial infection like pneumonia, urinary tract infection, every infection has got a potential to progress towards sepsis or a septic shock itself. So our job is to recognize that this uh, uh, disease process has happened, and even if you can not be able to recognize, being a non-medical person, the general person's responsibility is to report to a doctor or take the patient to a hospital when there is the infection is not being remitted, not being cured, and there are signs and symptoms of organ dysfunctions. पेशेंट हाँप रहा है, बीपी कम हो रहा है, तबीयत ठीक नहीं लग रहा है, यूरिन कम हो रहा है, आपका बुखार कम ही नहीं हो रहा है, राइट, देयर आर मल्टीपल रैशेस कमिंग इन द बॉडी, लिवर डिसफंक्शन हो रहा है. सो ये सारा सिम्टम्स अगर आप इस इन्फेक्शन के साथ हो और इन्फेक्शन ठीक नहीं हो रहा है, then something is definitely wrong, and it could be sepsis or a septic shock. So please connect a doctor. And what the experienced doctor would do, not only they would give a proper antibiotic, but also they will try to diagnose कि sepsis कहाँ हुआ है. They will try to cure that. They will try to reduce the burden if there is so, कुछ को हम सोर्स कंट्रोल बोलते हैं. कभी कभार there are different therapies which are available which can be useful in reducing the immune response, like a little bit of steroids, कभी कभार filter, कभी कभार even नहीं. साथ में if there is organ dysfunction to failure, we also do what we call an organ support. तो in cases like ventilation, dialysis, बहुत कुछ हम कर सकते हैं sepsis के बारे में. But the most important aspect, if it is at time, तो पेशेंट को आराम से बचा सकते हैं, और अगर देर है तो हम बहुत मुश्किल होता है. एक हमारा भारतीय कॉलीग डॉक्टर आनंद कुमार, उन्होंने तो एक स्टडी भी किया है जिसमें दिखाया गया है कि हर 1 घंटा लेट अगर आपका एंटीबायोटिक देने में होता है तो उसमें आपका 7% चांस ऑफ जान जाने का बढ़ जाता है. आप सोचिए, 1 घंटा लेट में 7% चांस ऑफ mortality goes up. So that is the significance of time or a timely intervention in sepsis itself. And also, more important is to prevent infection or to prevent sepsis to happen. And how you can do that? You can do a good hand washing, right? It prevents infection to happen. Whenever you are out, whenever you are visiting someone in the hospital, whenever you have traveling and all others. So be careful to wash your hands. Immunization is very important. We have an universal immunization program, vaccine program for children, and government, many of the states have started immunization program for the adults, particularly adults with a higher risk like transplant recipients, diabetes, dialysis patient should get immunizations against pneumonia, influenza, and others. So there are other immunizations like hepatitis, typhoid, cholera. These are all available. So you should consult your doctors if you are at a higher risk or if you think so. So you can take an immunization or the vaccines itself. So that prevents. And also, whenever there is some sort of outbreak of the disease process, जैसे COVID के time हुआ था, so use precautions, particularly like mask, hand washings, distance, quarantine. So ये सारे. So prevention is always better than a cure. तो वो भी sepsis के लिए लागू है. So to summarize, if you say that sepsis is a deadly disease, number one cause of mortality of hospitalized patient, and number three overall पूरा दुनिया में जानकारी जानलेवाकारी disease process है. So we need to be aware of it. For general population, it is very difficult to understand, but whenever you have a unremitting or relentless progression of infection itself with non-specific signs of organ dysfunction, always remember that this could be sepsis or septic shock. तो बिना देर किए तुरंत डॉक्टर साहब को कांटेक्ट कीजिए और पेशेंट को इमरजेंसी में लेके आइए. There are very effective therapies of treating sepsis, but provided you have brought the patient on time, and also more importantly, we can prevent infection in a simplest way of hand washing and vaccination. So let's remember 13th September to be a World Sepsis Day to make people more aware of sepsis, but all the days in a year is important to treat and prevent sepsis. Thank you. Next time we would come back with more interesting topics. Thank you.